Good morning. I'm here to bring you your daily mental health enlightenment. And today we are going to discuss bipolar disorder versus ADHD. Now, this is an important topic to discuss because these two conditions are so similar to each other that people often get them confused. And when you don't know which condition it is that you're really dealing with, then you don't adequately treat the underlying condition. Now, I'm doing this video for the parents out there who struggle to understand why their child can't maintain relationships and friendships with their peers. For the parents who can't understand why their child has such a hard time interacting with authority figures. For the parents who can't understand why their child, even with the support of them and the tutoring from the school, can't seem to be successful in school because they can't follow through on tasks and complete tasks, and they lack the motivation and drive to give their full effort to a task. I'm doing this video for the man or woman who is in relationship with someone who they constantly have conflict with, who they find they can't go 1 or 2 weeks without having some big blow up for something that they find really small or can't make sense of. For the man or woman who is in relationship with someone and they can't understand why that person is so paranoid about the things that they're doing, why they accuse them of things they haven't done or seem to be really jealous. I'm doing this video for the man or woman who are in relationship with someone and they can't understand why they are so financially irresponsible and they manage their money in such a poor way. I'm doing this video for the grandparents who have stepped in to take over the parenting role for their grandchildren. And on top of the generational gap that they're experiencing with their grandchild, they also can't seem to understand why their grandchild has such severe behavior problems that are so abnormal to what they dealt with when they were parents, and that cause such big problems in the child's life. I'm doing this video for the grandparent who is interceding on their own child's behalf, and they can't understand why their child can't use the values that they instilled in them to be a present and responsible parent to their child. Now, all those examples that I just gave are examples of symptoms of ADHD and bipolar. And so I often deal with people who give me these examples of presentations and struggles that they deal with people, and they're trying to figure out, is this bipolar? Is this ADHD? What is this? And I often find that people want to lean more toward ADHD because of the stigma related to bipolar. And so then often they're not being honest with themselves about some of the bipolar presentation that is there. And then of course they're not adequately treating what's going on if they're taking the route of ADHD when it's really bipolar that they or the person that they love is dealing with. Okay, so let's jump into this. Let's understand what ADHD is versus bipolar disorder, and then compare the two, and then figure out how do we begin to differentiate between them. Okay, so ADHD is a condition that is characterized by chaotic, cluttered, and disorganized mind, which leads to the person with ADHD having a chaotic, cluttered, and disorganized life. We typically think of ADHD as a hyperactive child or someone who can't stay focused or pay attention, but that all goes back to the fact that they have a chaotic, cluttered, and disorganized mind that causes them to be hyper, that causes them to be off focus. Now, bipolar disorder is a mood condition that is characterized by instability, chaos, and the maintenance of conflict in their life. And so we already see when we compare ADHD and bipolar, we see those similar chaotic underpinnings that are there that can make them look similar, because the person with ADHD and the person with bipolar both maintain high levels of chaos in their lives. So what I'm going to do now is I'm going to present to you 6 different sets of symptoms that are both ADHD and bipolar, and we're going to show how they're similar, but then we're going to talk about how the underlying reasons that they're there are different for ADHD and bipolar. So the first symptom is people having a hard time paying attention, focusing, concentrating, staying on task, completing tasks. Now with ADHD, there is usually an impairment in the frontal lobe of the brain, which is the last part of the brain that develops because it's the part of the brain where our higher level of thought processing occurs. So this is where our ability to plan, to manage time, to problem solve, to reason, to make good choices, to make cause and effect relationships in the future, that's where all of that comes from. And the person with ADHD has a deficit with the frontal lobe of the brain. So they have a hard time doing those things. And because of that, they then have a hard time with being able to maintain attention and focus, being able to sustain mental effort during tasks that challenge them, being able to stay on task and follow through with things. Now, the person with bipolar disorder also has a hard time paying attention, staying focused, staying on task, but it's because when someone's dealing with bipolar disorder, they have these swings in mood that makes their affective state unstable, causing them to have an overall unstable presentation. They also have racing thoughts that they experience and an excessive level of energy if they're manic. And because of all of those internal things going on with the person with bipolar, they have a hard time being able to focus, pay attention, concentrate, stay on task, all of those things. Now, the second symptom is hyperactivity, having a hard time sitting still and being productive. For the person with ADHD, again, that frontal lobe piece is what makes it hard for them to be able to, again, sit still, control their body impulses, follow through on a task long enough to be productive on it and to do a good and thorough job on that. Now, for the person with bipolar disorder, again, they have these excessive amounts of energy. The person who's manic feels like they can conquer and take on the world. So they take on a number of different tasks that's too much for any one person to be able to manage at one time. But when they're manic, they're not sleeping. They have all this energy. They're able to devote excessive amounts of times to different tasks. But then they downslide into a depressed state and they leave all these tasks undone up in the air. And so they too are unable to be productive and get things done. All right, so the third symptom is impulse control. And this leads to a person engaging in rapid and excessive talking, over talking people, not maintaining appropriate bounds within a conversation, so they don't know when to be quiet and allow the other person to talk. They have a hard time waiting their turn. They can even become aggressive when you try to set the bounds with them. And again, that's because of that frontal lobe impairment that the person with ADHD has. They have a hard time with impulse control. They have a need to immediately gratify their needs, and so they're not thinking long term. They don't have the ability to be patient, to reason and make a judgment that I need to sit and listen and formulate my full thought and hear their full thought before I respond. They don't have the patience to do that. Whereas the person who is dealing with bipolar disorder has a hard time controlling the impulse to talk, maintaining appropriate bounds with people, controlling their aggression. One, because of the internal instability that they feel, which keeps them in an overall unstable state and kind of in an irritable place too, but also because they experience these racing thoughts and there's so much going through their head, they don't even realize that they don't realize the excessiveness of the thoughts that they have, so they don't realize that they're bombarding you with way too much information. All right, the fourth symptom is forgetfulness. And for the person with ADHD, forgetfulness, again, is an ingrained symptom that they have, because being able to remember, grasp, and hold on to information, again, is a higher level cognition. We don't expect a 4-year-old to be able to multitask and keep track of a set of instructions. But once that frontal lobe is developed, someone can multitask, be given a series of instructions and follow them in in order without making mistakes. But the person with ADHD can't do that because of that frontal lobe impairment. Now, the person that has bipolar disorder, again, is experiencing this emotional instability that keeps them in an overall unstable state. They've got all these racing thoughts going on that they then internally have so much going on inside of them that it's hard for them to be calm enough to grasp information that's given to them, to hold on to it, to retain it, and then to use it to their benefit in the future. All right, the fifth symptom is a person who presents in an immature and childlike manner. Now, for the person with ADHD, again, it goes back to that frontal lobe impairment where they have a hard time being able to reason, to make judgments about things, to make good choices, to think into the future about the cause and effect of a certain action that they may have. And because they are acting in the moment, out of emotion, out of what they want right now, they can appear very childlike. Now, the person with bipolar disorder can present in an immature manner because when they're in a manic state, they have heightened levels of energy. They can have just an irresponsible nature to them. I want to do something. I want to do it now. I'm not thinking about the consequences in the future. And then there's also a thrill that a person who is manic gets out of risk taking. So they do things that could bring harm to them, bring harm to you, but they find it exciting and fun. And all of that for a person who's not in that state can seem immature and childlike. Finally, the last symptom is people who lack the ability to give full effort, full energy into completing a task. So they do things half-heartedly and they're not thorough with what they do. And again, the person with ADHD does this because of the impairment in the frontal lobe, and so they have a hard time, again, sustaining the required level of mental persistence to be able to pay attention to detail, to be able to recognize when they've made a mistake, what areas they need to pay more attention to, what areas they can give less attention to. Now, the person with bipolar disorder lacks the ability to put full effort into a task and be thorough on it because they're typically in a depressed state. And so they're experiencing depression-related lack of motivation, energy, and drive that causes their task completion and productivity to be poor. And so we've gone through 6 different symptoms of ADHD and bipolar, and we've identified that the symptoms are the same, but the underlying reasons and motivations that those symptoms are there are different for bipolar and ADHD. And it's important to understand that because when you're treating these symptoms, you want to make sure that you're treating the correct underlying condition, or you'll never completely manage what you're dealing with. Because remember, a symptom is simply a manifestation of what's going on deeper. So you have to understand what's the deeper issue. How do I treat that so that then you can see better results in your life, living a more quality life. All right, I hope that this video has helped you. I'm constantly getting feedback from people that they like to understand what's the difference. They want to not be so afraid of a bipolar disorder diagnosis, and so I decided to do the video. All right, so what's the message? To think about mental health in a different way, a way that helps you to understand that there's no shame with having either ADHD or bipolar disorder, but it's important that you learn the difference. And I'll see you tomorrow.